Dr. Wilkins, can you tell me a little bit about your smart pulse?
Yeah, so this is some really great technology. I've used a few different devices that use pulse wave technology, or they're based on what's called plethysmography. They also use heart rate variability algorithms to find out what the patient is going through. So I loved it because back in 2005, when I first learned about how great arginine is, I learned about this device at the same time. Of course, being a practitioner, we love things that are tools that can show people where they're at. You can put them on a protocol and then you can rescreen. And when you can see results from what you're doing, that's the name of the game, right? So not only are they anecdotally feeling better, but we can actually see that they're doing better. So this test, it's non-invasive. It's just a finger cuff that looks like a pulse ox, but it's calibrated to pick up on changes in pulse waves. So there's 7 different possible pulse waves that are created, and it gives a number based on the pulse wave. 1 is the best case scenario, 7 is the worst. And basically what it's measuring is infrared light that goes in through the nail bed, and it sees how the hemoglobin lines up. And when you have good flexibility, you get one type of a pulse wave that's made. And with each successive degree of stiffness or atherosclerosis or whatever is causing constriction, it can go from, 1s and 2s are what we like. And if it's a 3 or worse, regardless of their age, we try to get them back to being a 1 or a 2. So it uses that pulse wave. Also, the heart rate variability shows stress levels of the individual, and heart rate variability is very well established in the field of medicine as being even a predictor of mortality. So it's a pretty cool way to monitor people's results. And so you measure their stress, and then it does in combination this plethysmography, which shows the flexibility of the arteries, gives them that number, gives them an arterial score. And then we put the individual on a protocol, whatever that might be. And again, using typically these arginine, citrulline, antioxidant based nutraceuticals, and then put them on a protocol for 90 days and then come back and rescreen in 90 days. And if they've been following the program, 90% of the time will show improved results in that very non-invasive, easy, very inexpensive. They used to be like $7,500 when I first got started. Now they're $500. Connect to a mobile device by Bluetooth. Very easy to use and interpret. And 90% of the time, again, they test better. So it's a really cool way to monitor and follow up on the patient's progress using smart pulse. I think every office should have one. Just like they have a blood pressure cuff, you should have a smart pulse unit as well.
Yes, and Bionox is offering quite a nice special on their smart pulse currently, right?
Absolutely. Absolutely. Yep. We have package deals that are available that include our nitric oxide nutraceuticals along with the smart pulse. So absolutely, there's very economical way to get involved.
Right. Fantastic. Thank you.